And for the viewers, we're going to get into neurotransmitters. Those are the chemicals in your body, especially in the brain, which control so many of the body functions. Many of you are aware that it controls mood, memory, but there's so much more to it than that. Your metabolism, how your digestion functions. And Dr. Shallenberger has done a lot of work in this area, and we're going to get more of the specifics of how neurotransmitter therapy can help you. So Dr. Shallenberger, maybe give the viewers a little bit more of an overview. I kind of just skimmed the surface there. Really, what are neurotransmitters? What are these chemicals? Go into how they affect many different areas of the body, and then how in medicine we're able to help people with this type of approach.
I think this topic, Mark, is probably the most important topic, single topic we could even have today, because this cuts to the very core of the relationship between stress and health. And as I'm sure you know, and pretty much any doctors who've been around the block know, stress plays one of the biggest roles on what makes us healthy, what makes us sick. And the connection is that your nervous system runs your entire body. It controls your immune system, it controls your digestion. Everything that's in it is regulated by your nervous system. But what regulates the nervous system is neurotransmitters.
Right.
And they're chemicals, you can call them brain chemicals if you wish, but they're chemicals that are not only in the brain, but they're all in what we call the periphery, but your nervous system throughout your entire body. And these chemicals must maintain a balance. And now they're going to get out of balance all the time. So when we're stressed, when an accident happens, when we're fighting an illness or whatever, the body's going to run out of homeostasis, and these brain chemicals are going to become out of balance. And what better happen is we better have systems to put them back into balance, because if we don't, that's going to be the occasion where you hear a patient say, you know, I was doing just fine until this happened. You know, I got a really bad infection, or I had a very bad emotional trauma, or you know, I had a bad injury or accident, and then nothing came back. I didn't bounce back. I didn't come back from this. And this represents then an imbalance of these neurotransmitters. And the really interesting thing, the really powerful thing is that you can bring them back into a balance using natural therapies.
Right. Well, let's contrast that with conventional medicine right now. Conventional medicine obviously does acknowledge that neurotransmitter imbalance exists. Common conditions like depression, anxiety, bipolar disease, obsessive compulsive disorder. There are many, many different types of drugs which are used, which are called psychiatric drugs. And some people certainly get symptom relief. Obviously, there's a whole host of different serious side effects you can get from these medications that range from suicidal thoughts to weight gain, to changes in your immune system. But the beauty is, like you said, we do have natural ways to balance out these neurotransmitters. So let's talk more about that. Okay.
Yes. Basically, although there is a multiplicity of chemicals in the nervous system that are involved in this, these chemicals can be modulated by 4 amino acids. All of these chemicals can be modulated or changed or corrected by only 4 amino acids. And that would be cysteine, tyrosine, 5-HTP, and L-DOPA. So by finding the right mix of those for a given person, you can pull them out of depression, bipolar situations. You can pull them out of mental cognitive disorders like memory loss. You can pull them out of ADHD, hyperactivity sorts of syndromes. You mentioned obsessive compulsive, but also a host of other illnesses, anywhere from Crohn's disease to restless leg syndrome to seizure disorders. All of these things come under the purvey of neurotransmitter imbalance.
Sleep problems.
Absolutely, insomnia.
Yeah, irritable bowel syndrome.
Think of anything that certainly is related to stress. If it's related to stress, it's due to an imbalance of these neurotransmitters that never bounce back.
And so the unique thing with the natural approach Dr. Shallenberger is talking about, we can use these amino acids basically as precursors or nutrition, if you will. So the brain, the gut, the other areas of the body can make these neurotransmitters on its own. And because you're not forcing it on the body, you don't get the side effects you do with the drugs.
At the Stengler Center, a variety of treatments are offered, from nutritional counseling to hormone balancing, from intravenous nutrient therapy to breakthrough weight loss programs, from muscle and joint treatment to cardiovascular support. Our physicians also specialize in chronic fatigue therapy, diabetes treatment, integrative cancer support, mood balancing, and more. For a complete list of treatments offered and conditions addressed at the Stengler Center for Integrative Medicine, please visit our website. Call or email the clinic with any questions you may have.